Imagine that you were Little Red Riding Hood skipping through the forest on your way to your grandmother's cottage. You knock, but there's no answer. The door is unlocked, so you step in and call for Granny. However, instead of finding a wolf in the cottage like in the usual story, you find Granny unconscious on the floor. What do you do? In this case, Granny can be saved if you know the basics of CPR, or cardiopulmonary resuscitation. This is used to keep people alive until medical assistance can arrive. As a daughter of two medically trained professionals, I know the importance of this life-saving training. In my speech today, I will break down the 3 essentials of CPR. Check the scene and call for help, begin compressions, and follow with mouth-to-mouth resuscitation. Back to our scenario, you find Granny unconscious on the floor. The first step is to survey the scene, make sure that it is safe for both you and the victim. If you find your victim in a chair, you need to set them on the ground. If you find them in water, you need to put them on land. The key here is to get the victim on their back on a hard and flat surface. Next, check for responsiveness. The best way is to shake their shoulders lightly, yell their name, "Hey Granny," and to rub your knuckles on their sternum. Now, you need to call 911 and give them as much info as you can about your situation. If there are other people around, have them call. Because most cardiac events happen at home, 88% according to American Heart Association study from 2011, it is important to know what to do in this situation. When effective CPR is used, it can double or even triple your victim's chances for survival. So, as soon as you call 911, it is important to move on to the next step as quickly as possible. The next step is to begin compressions. To do compressions, you will place the heel of one hand onto the victim's sternum. You will then take your other hand and intertwine your fingers on top of your other hand. You will then put your elbows and your shoulders over the victim and begin the compressions. You will push down about 2 inches into their chest at about 100 beats per minute. The key here is to kind of do it to the beat of Staying Alive by the Bee Gees. Now, our next step is dependent upon the situation, but it is still very important. In some situations, the last step is crucial, but in others, it's not really necessary. This is mouth-to-mouth resuscitation. To clarify, CPR only involves compressions and is recommended for use when you see a teen or an adult collapse. According to the American Heart Association, conventional CPR, which is the CPR that uses mouth-to-mouth resuscitation, is for best use with infants or the elderly, teens or adults who you find in cardiac arrest but you did not see them collapse, or of a victim of drowning or drug overdose. If you find yourself in this situation and have to use mouth-to-mouth resuscitation like you would with Granny, the steps are pretty simple. The key here is the 30-2 rule, 30 compressions and 2 breaths. To perform these breaths, you must first place your hand on their forehead and tilt the chin and lift it. You will then pinch their nostrils and put your mouth on theirs. You will give them 2 normal breaths for about 1 second each. You will then go back to the 30 compressions, 2 breaths, 30 compressions, 2 breaths. You will continue this until help arrives. However, if you were in the situation where you were using hands-only CPR, you would simply just do the compressions until help arrived. All of these steps are pushing towards one major goal, to keep the victim alive. To recap, if a person is in cardiac arrest, you need to act quickly. First, check and make sure that the scene is safe. Then, check for responsiveness and call 911. Third, begin chest compressions on the center of their chest, 100 beats a minute. Also, if the victim is found unconscious, or is an infant or the elderly, you need to use mouth-to-mouth CPR. Knowing these steps can help you avoid an unnecessary death, and if you can perform the basics of CPR, Granny has a chance to live and see another day.